Hello everyone, it's Dr. Jack Krasuski. Welcome. Thank you for being here, and sorry about a couple minute delay. You know how it goes with these technical issues. We are here now live, and I've got a very exciting program for you. Exciting, that is, if you're taking the Psychiatry Certification Exam. Otherwise, it's going to be super boring, so go ahead and have an ice cream instead. I'm not here by myself this evening. I have two of my teammates here. First is Angela Chiavon. She's our social media manager, and here, yeah.
Hi.
All right. Thank you, Angela. And the man behind the scenes is Jeff Maher, who's running the show. And so let's get going. The topic for tonight is the 2018 Psychiatry Certification Exam. Now, if you're taking any other psychiatry exam, that's okay. If you are taking the MOC exam, we actually did a Facebook Live event 2 weeks ago, and it's down in our feed. If you can't find it, then certainly just email me and we'll send you a direct link to it, because we also have it on YouTube. If you're interested in taking the child adolescent exam or the geriatric psychiatry exam or whatever, then let me know, because we are going to plan for some future events to cover those exams too. All right, but today's topic, again, it's Psychiatry Certification Exam. Let me start with the big picture view. When you registered for the exam, then in the mail you were supposed to, were advised to pick a Pearson Learning Center where you're supposed to go and take the exam. By the way, do not delay in registering a spot in one that is close to you. Just a couple of weeks ago, I had an email from one of our colleagues who was lamenting that she waited too long. She was taking the MOC exam, but she waited too long and then could not get a spot in her city, and so she had to pick a spot in a city 100 miles away or so. Then she had to get a hotel, and she was sleeping the night before the exam in a hotel, was not sleeping well, and she said she kind of recommended to me that I recommend to all of you, please register early. You don't want to be stuck with those extra complications when you're taking a very long exam. When you go, please bring two IDs. One of them has to be a picture ID, either a state driver's license or a passport. Now, when you go into the Pearson Learning Center, you could certainly have things with you, but you have to leave all of them in sort of like the entry room, where they have little lockers, and then you have to leave your purse, your lunch, your water, everything, books, anything you brought, you have to leave it there. They give you a key, you pick it up at the end of the day. So you cannot take anything in there into the actual exam room itself. You're fingerprinted or palm printed. Some of the devices are palm prints, and your finger palm printed at the beginning, and then every time you go off for a break or lunch and you come back, you're fingerprinted again. So it's like trying to break into Fort Knox, okay? Now, when you're in the exam room, you can, before you go into it, you can request to have a whiteboard and an erasable marker during your time taking the exam. Now, obviously, there's, what can you use that for? And sometimes, I'll tell you how it would be useful to me. I don't like using them, but it would be like, let's say if I had an exam question and I was kind of struggling, I don't quite know the answer, so I'm kind of working my way like a process of elimination. I'm like, okay, that's not E, so I might write down, okay, E, it's not C, okay, I guess it's not D. And then it's like, okay, which ones are left? I could say, oh, I eliminated, E, D, and C, so I still have A and B. So there are ways, that having an erasable whiteboard may be useful to you. Now note that in every question that includes a medication name, the medications are all generic. Now, all our lectures are, are using generic terms, names of medications, and one of the reasons is because we want you to get used to those. Now, in case you run across a generic medication name you don't recognize, that's okay. There's a drop-down list on your screen on the upper right corner, and you could cross-reference. Obviously, it's best not to have to do that for every single generic term, because it's going to slow you down. But if you run across one every once in a while, No worries, no worries. All right? And now let's move on to the actual exam itself. It's 9.5 hours. Yes, this is a very long exam. So I know this is going to sound like a complete waste of my breath to kind of tell you something so obvious, but let me tell you anyway. Please get a good night's sleep. Get hydrated, get a good night's sleep. I don't want you to be like pulling an all-nighter or something as if this was back in college or something. It's going to work against you. The thing you have to do to maintain your stamina, and I'm not just saying physical stamina, but your mental stamina. Imagine that, that level of concentration over those many hours. You need to be well rested. Now, if you're kind of concerned, oh my God, I'm not going to sleep well, maybe I should take a sleeping pill, whatever, maybe even like something like diphenhydramine over the counter, like whatever. Don't do anything for the first time the night before your exam. If you want to experiment with some sleep aids, some prescription hypnotics even, do so like a week before, all right? So out of those 9.5 hours, this is how it's broken down. The actual exam time when you're sitting there answering questions is 8.5 hours. That's 510 minutes. Now, you additionally have 5 minutes before and 5 minutes after, for some kind of house cleaning kind of stuff. And then you have 50 minutes of allocated, pooled break time. Pooled break time. So the exam is divided into 8 sections, and between each of the sections, that means there's 7 break times in between those 8 sections, you can take a break. You do not have to take a break, and you can, maybe do the first 2 sections, then take a little break to, rehydrate, use the bathroom. And by the way, never feel like you're in such time pressure that you're trying to take the exam with a full bladder because you're kind of thinking like, I don't want to take the break time. The 50 minutes are above and beyond your 8.5 hours of exam time. So please use up, that 50 minutes. You don't have to, but do it if you feel like you need to take that break, again, to urinate, rehydrate, and take maybe a longer period for a lunch break, all right? Now, if you are gone for more than 50 minutes in total for your break time, then that starts counting against your exam time. That starts eating into your 8.5 hours of exam time. Now, what is the pace of the exam? Well, if you have 510 minutes and you have 450 questions, that's 68 seconds per question. Is that a lot? No, but it's adequate. That's over a minute. So even when you have these vignette questions, you do have plenty of time to read them. In fact, if you're kind of spaced out and you're reading it and you're like, what was I just reading? You have time to reread it, okay? So for the vast majority of doctors taking this exam, as with every other exam, they don't run out of time. And some doctors are going to be very, very quick and actually have a couple or even 3 hours left over. So now, what about pass rates? I wanted to give you this right up front to kind of like maybe set your mind at ease, or at least somewhat at ease. So this is a difficult exam, and so the ABPN lists their Psychiatry Certification Exam pass rate for 2017 as 77%. So that's bad. I mean, that's not good at all. But the good news is, now here's the good news, to beat the boards, our pass rate for doctors who take our course for the Psychiatry Certification Exam have a 95% pass rate. Now, how do we calculate that? Well, as you know, when you buy our course, we have a very good guarantee. It's more than a money-back guarantee. So we're, to come up with this figure, we're assuming that everyone who does not pass will ask for their money back because, I mean, that's a lot of money to leave on the table. But that's how we calculate it. We just kind of look at what percentage of people ask for their money back, better than money back guarantee. So, it is a tough exam, but, if you're listening to me now, that shows me that you are motivated, and then you will probably be studying. So you're probably not just the average candidate for this exam. So good for you, because that means your chances of passing are going to be very good. All right, so this is just right off of the ABPN website, shows you the eight sections divided by the 7 optional breaks. And one thing to notice is that these sections are of 2 different types. They're the standalone questions, and then the next section is vignettes. So they kind of alternate, standalone, vignette, and so forth. And we're going to go over those. So the standalone questions, that's half the exam. So what is that, 225 questions, and the vignette questions, that's half the exam also. So now, okay, let's look at what are the big topics, right? Because, inevitably, you're going to wish you had more time to study. I know life is busy, it's hectic. What should you focus on? Well, it's like the Doc Sutton rule. Why did Doc Sutton rob banks? Because that's where the money was. That's where you want to spend your time, is on the big topics, where the money is. All right, so the 7 big topics on this Psychiatry Certification Exam are as follows. They're the substance-related and addictive disorders, the psychotic disorders, the depressive disorders, bipolar disorders, anxiety disorders, personality disorders, and the neurocognitive disorders. Okay, kind of makes sense. Those are, if you want to look at it in terms of the DSM-5, just those are those 7 chapters that you should really be focusing on. Now you'll notice on my slide here that I have 1 row in red, and those are the neurologic disorders. So starting last year in 2017, the ABPN really cut down on the neurology questions. So in 2016, it was still 25% of the exam, and a couple of years before that, it was like 32%. So ABPN has really been cutting back on the neurology questions. Now, you might be thinking, well, getting kind of rid of most of the neurology questions, that make the ABPN pass rate go up, and it actually didn't. And that is consistent with our findings over the years, that the doctors who took the exam, they tended to do just as well on the neurology as they did on the psychiatry questions, whatever their percentage happened to be. Now, what I was just showing on that slide was what ABPN calls Dimension 1, which is basically like the disorder categories, like I just went over, depressive disorders, bipolar disorders, anxiety disorders, and so forth. They have a Dimension 2, and that means within each of the disorder categories, what is the focus? And there are 3 main areas of focus. Let's just take panic disorder, for example. So if you're going to see a lot of questions on panic disorders, you're likely to, what are they going to focus on? And the 3 areas are, number 1, neuroscience and mechanisms of disease. Number 2, clinical aspects of psychiatric and neuropsychiatric disorders. And 3, treatment, right? And actually the biggest category is treatment. So let me start off with the first one I mentioned, neuroscience and mechanisms of disease, because that's the one that may kind of like get you most anxious, like, oh my God, how much neuroscience am I supposed to know? The answer is, now we're talking about the psychiatric disorders, it's really etiology. So, you have to, the highest percentage of etiology questions are going to be on the neurocognitive disorders, the dementias and the delirium. And you do have to know a lot about, Alzheimer's disease and the pathology and different types of prion disease and all of that stuff. And of course, in the exam, we go over all of this stuff. Now, do you need to know any genetics? Well, yeah, sometimes, like in autism, I think it's important to understand Fragile X syndrome. In other areas, Huntington's disease, you need to understand that. Tuberous sclerosis complex, going back to autism spectrum disorder. So those are examples of, kind of the etiologic focus of these questions. The second category, clinical aspects. This is just recognizing the disorder. When you're given a description, a patient comes in with these symptoms, A, B, C, and D. what's the most likely diagnosis, right? And then, of course, treatment. What do you need to know in treatment? Well, you need to know the somatic treatments. First and foremost, medications. You got to know medications. You have to know kind of like which medications would be considered first line. And then they cleverly often write questions where they already say that this patient had received like some first-line medication and failed. And now they ask you, what's the next treatment option? And they're forcing you to think down the treatment algorithm. Like, okay, well, they use a first-line med. What are some second and third-line medications, right? Also, there are a lot of drug-drug interactions. Again, we go over all of this in the course. But as I mentioned, there's somatic treatments, so you do need to know some stuff about ECT and deep brain stimulation and transcranial magnetic stimulation and things like that. And then, of course, the psychosocial treatment. So there are questions on cognitive behavioral therapy and kind of also just on learning theory, like questions on reinforcement and punishment and, you know, positive and negative reinforcement. They like to go into that stuff, and that's also in the course. And then the other kind of psychotherapies, and then other kinds of forms of treatment, like assertive community treatment, things like that. Okay? All right, now let me delve into the details of the two exam section formats. And the standalone sections, as I mentioned, it's 50% of the exam. These are written questions, and they're single best answer. So you have 4 or 5 response options, and you just have to pick one. It's the single best answer. That doesn't mean all the other 4 are just completely bad and wrong and ridiculous. It's usually a range. There might be 1 or 2 kind of like really far out ridiculous ones. You know, maybe a couple like sensible ones, but you need to pick the single best one. And I'll talk more about that, how to handle your own thought processes when you're trying to decide on the best answer. Now, even in these standalone sections, there are some vignettes, but they are short standalone vignettes. So there are really 2 exam formats in the standalone section. Some are short standalone vignettes, and the other ones are just simple fact-based questions. And I'll show you those in the slides coming up. Now let's look at the vignette sections. These are, you can call extended vignettes. So there's typically 2 to 10 questions that are linked to a common case, extended case. And the way it might look like is, if it's a written vignette, you might have like a paragraph or 2, and then it asks you 1 question, a second question, and maybe it gives you more information. You know, maybe you send the patient for some labs or neuropsychological testing, and now they can say, well, the results are in, and these are the results. Now, kind of, what do you think? And maybe there's even a third, you know, a little additional section of content of the vignette, and then maybe a couple more questions. Now, some of the vignettes are either audio only or more commonly video. So the most common extended vignettes are either written vignettes or video vignettes. So again, you might have a couple minutes, minute and a half, 2 minutes of a video clip, a couple of questions. Next kind of like section of that, let's say interview, clinical interview with the patient, another kind of snippet of video, another couple questions, and so forth. Now, these questions, not only they differ in, you know, being extended vignettes and also often video vignettes, but also they are not a single best answer. So they could be choose 1, choose 2, or choose 3 response options. And, you know, it could be something like, what are the most likely diagnoses in your differential diagnosis? And then it has in parentheses, choose 3. Okay? So now, let me clarify how this works. Each of these questions is scored individually. So if you have an extended vignette with 4 questions and you get 2 of them wrong and 2 of them right, you're going to get credit for the 2 that you got right. But within a question, if it says choose 3, you have to get all 3 right. You know, they can't give you like 2/3 of a point because you got 2 out of the 3 right, you know. So it's either you get the question right or you don't get it right, right? So you have to get all, if they tell you get 2, choose 2, you got to get both right. If it says choose 3, you got to get all 3 right within the question. All right. Last point here in this section is the possibility of you reviewing questions, meaning going back to them. And the standalone sections, again, the number 1, 3, 5, and 7, those sections, they're standalone questions. So you can go back to view the questions. So at the end of every section, you will then see like a review, a summary screen, and it will show you all the questions that you tagged for review, because you have that option, and also show you any questions that you did not answer, and then you can either go back to the questions you didn't answer, or go back to the questions you tagged, or both, or you can then exit the section. Once you exit the section, you're done, it closes down, and you can't go back. And this is where you can have your optional break. Now your optional break might be like taking a deep breath and moving on to the next one. I mean, there's a lot of sections, you don't have to take a break between each one, but you can. Now in the vignette section, since these are linked vignettes, and you have more content being presented to you as you work your way through the questions associated with that extended vignette, you cannot go back to the questions, because sometimes the later questions will reveal some information that would have like answered an earlier question. So on those vignette sections, which is 2, 4, 6, and 8, there's no possibility of going back. Okay? Now I'm going to add something right away. I'm going to cover this more at the end, but I want to tell you this right away. That, because I can already, like even just through the camera and through thousands of miles away from me maybe, I can already kind of feel your anxiety about like, oh my God, I have to like leave a section and kind of hit a button and say I'm done and then just leave it. Or I answer a question in the vignette section and I can't go back. And I could already kind of feel your anxiety rising. Okay? So don't worry. You have to trust yourself. You have to trust yourself. I trust you, you trust yourself. All right? Again, the people who take our course, and I'm assuming you are, you wouldn't be hearing about this if you weren't, very high pass rate. All I'm asking you to do is what you're already doing, is prepare. And then the second thing is trust yourself. You got to trust yourself. You can't drive yourself crazy second guessing yourself. Pick the best answer you believe in your heart of hearts is the right answer. Answer it and then let go. You have to let go. And you know why that's so important? Because right after you answer a question, guess what you have to do next? Answer the next question. You're not going to be very good at answering the next question if you're worried about the previous question, right? You have to have the discipline to look at a question, focus wholeheartedly on it, respond to the best of your abilities, let it go, and move on to the next question. I like to say you got to make like a soldier. When you're a soldier on a battlefield, you can't be thinking about like what happened this morning when someone almost killed you, because if you're focused on the past, you're more likely to get killed in the present moment. You have to keep your wits about you and always focus on the present question. Do your best, answer it, and move on, let it go. And then afterward, if you want to cry about it and stay up nights for the next 2 days, hey, be my guest, but just don't do it during the exam. So by the way, this is like my little representation of how that review screen looks at the end of each of those 4 standalone sections. Again, the vignette sections don't have that. Now let me tell you some details about these questions on the standalone sections. So many of them are diagnostically focused, and I'm going to focus on that here on this slide. So the way these diagnostically focused questions, where it said clinical presentation, I read that to you, that's really kind of what it's talking about. Like most of those are diagnostically focused. You're presented with a clinical vignette with a bunch of kind of description of symptoms, and then you're asked what the most likely diagnosis is, right? So you're not so much being tested on the criteria. It's not like, which one of these is a criterion of panic disorder, or which one of these is not a criterion of whatever major depressive disorder. It's not like that. You're presented with like a vignette, clinical vignette, and asked, what is the most likely diagnosis? Is this going to be somatic symptom disorder, or is this going to be illness anxiety disorder, right? Obviously, they're going to throw in some of those less common disorders, so you're asked to recognize them when you see a clinical vignette of them. And usually the most kind of obvious answer, is the right one. So if a vignette includes a description of 4 symptoms of major depressive episode, then and there's no history of mania noted in the question, then the most likely response is major depressive disorder. And you can't be saying like, oh, it can't be because you need 5 symptoms or whatever. It's probably going to be major depressive disorder. So now, what are the implications for your study given this? Don't just review or memorize disorder criteria. Again, indirectly you're being tested on criteria, but not directly. So learn how one disorder differs from a similar one. And a great example is one I use, because I didn't use it randomly. How does somatic symptom disorder differ from illness anxiety disorder? It's a great question to ask yourself. So if you actually, and I challenge you, you can even do this today after we're done talking, look those up in the DSM-5. And when you look at them, you're going to be like, okay, I think I got it. But if I asked you like kind of, okay, quick, in 10 seconds, tell me how they differ, you'd probably be like, oh, gee, what was that again? Those criteria, in the DSM-5, there's so much verbiage, and everything becomes very muddy, right? So there's a very simple answer, actually. The main difference between somatic symptom disorder and illness anxiety disorder is somatic symptom. You need to have a somatic symptom, at least one, like pain, or dizziness, or numbness, or nausea, or some sort of like I don't know, problems with your leg, anything, and everything is, as long as it's a somatic symptom. People with illness anxiety disorder, that's more like they're obsessing, like hypochondria. It's more just thoughts. There could be behaviors associated with, like seeing doctors too, but they don't have prominent somatic symptom. So that's just like one example, right? As I put here. Here's another example. Here's the main criteria, or diagnostic features, they call it on this page, of a neurocognitive disorder with Lewy bodies. And you have 4 diagnostic features and a couple of suggestive diagnostic features. Fluctuating cognition, recurrent detailed visual hallucinations, Parkinson motor symptoms starting after cognitive decline. That's important because if it starts at the same time, it's a different disorder. And the suggestive ones are REM, behavior sleep disorder, and severe neuroleptic sensitivity. But again, you're not going to be tested on those directly. This is how you're going to be tested on neurocognitive disorder with Lewy bodies if it's a diagnostically focused question. So this is how it would go. A 72-year-old male patient with cognitive impairment develops frightening visual hallucinations. You prescribe low-dose risperidone. The patient develops severe bradykinesia, tremor, rigidity, and gait disturbance. Right? They don't say that those are Parkinsonian motor symptoms, but they are, right? His adverse reaction suggests which neurocognitive disorder diagnosis, and the answer is going to be neurocognitive disorder with Lewy bodies. And by the way, this is, although this is a vignette, this is the type of vignette that could be found on the standalone sections too, right? Now, on the standalone sections, there are also, remember I said there are also fact-based questions. They're usually much shorter. So, for example, what is the most common cause of preventable intellectual disability in industrialized countries? Down syndrome, fetal alcohol syndrome, Fragile X syndrome, prenatal birth trauma, or Turner syndrome, right? And notice there's a key word there, and it's key because if that word wasn't there, the answer would be different. Because it's preventable, it's going to be fetal alcohol syndrome. So here are 3 ways I could have written that question just by changing the key word. So if I said, what's the most common cause of intellectual disability, period, it would be Down syndrome. If I said, what's the most common cause of preventable intellectual disability, it would be fetal alcohol syndrome. And the most common inherited cause of intellectual disability is Fragile X syndrome, right? Down syndrome, or trisomy 21, is certainly a chromosomal genetic disorder, but it's usually, in like 97% of cases, not heritable. Okay, so now let me give you some exam taking tips on these type of questions. If you are unsure, please read the question again. All right, you do have the time, especially if you're reading it and you're spacing out and paying attention to some other question. Read it again. Identify the key point. Ask, what am I being asked about? And if there's anything unusual about it, think like, why did they include that information? Like, here's an example. Let's say there's a patient who has some types of physical and mental, emotional and cognitive symptoms, and then it has something about him, working, his lifetime in some sort of chemical plant or something like that. And, you should ask yourself, well, why did they throw that little, kind of personal history nugget in there when maybe they're trying to point you in some direction? Maybe this is some sort of toxicity or something like that. Or if it's like all of a sudden it says that this person, works in agriculture, well, maybe this is organophosphate poisoning or something like that. So always pay attention to those details. They're usually in there to guide you towards a certain answer. They're testing your ability to pick up on clues, all right? You're the diagnostic detective. When you're answering questions, it's good to clearly, to eliminate clearly wrong answers. And that's where that whiteboard can come in. Like you eliminate, if you eliminate one question out of 5, one response option out of 5, and then you choose among 4, well, you've raised your chances of getting it right from 20% to 25%. If you can eliminate 2 of them, and you're choosing, 1 out of 3 of the remaining ones, now you've raised your chances of getting it right to 33%. So do not leave any questions blank. Answer all of them. If by chance, this will not happen, but just in case, if you're kind of like, oh my God, I'm out of time, there's a minute left, and I have 20 questions I didn't answer, just click on choose B or whatever on every single one. Do not leave any blank. Okay, they don't subtract any points for wrong answers. Don't fret over every question. The percent that you need to pass, it's usually like around 70% of questions that you need to get right. That means you can get like around 30% wrong. So out of 450 questions, so that's 45 times 3, so that's 135. You can get 135 questions wrong and still pass the exam, all right? So you're going to get a bunch of questions wrong. You are, I guarantee you, these tests are not designed for anyone to be able to get 100%. It's not like the SAT or whatever. I know those are hard to get perfect scores, but these are next to impossible. All right, now let me give you details about the Vignette exam questions, and I'm going to take a sip of water here. All right, so rather than talk around it, I'm just going to show you what an extended vignette would be like. And then I don't break it down into like 2 or 3 parts. I just present like a main part, and then we go through 4 questions. And then I'll talk about what the learning points are. So let's read this together. An inpatient medical service requests a psychiatric consultation for ongoing management of a 78-year-old female who is currently being treated for dehydration. The day of admission, the patient was found by a grocery store manager to be extremely nervous and reportedly seemed lost in the grocery store. She appeared tearful and tremulous when the manager and assistant tried to assist her. She repeatedly screamed, "Quit looking at me." She was unable to verbalize what had created her concerns or where she lived. An ambulance was called and she was subsequently transferred to the emergency department for further evaluation. Her personal belongings revealed an empty pill bottle in her purse with a 3-year-old prescription for alprazolam. The name on the prescription is apparently that of her husband's. Her personal information reveals her address to be a few blocks away. When her home telephone number is called, there is no answer. Social services learned that her husband passed away nearly 2 years earlier. They had no children and there are no next of kin. According to the medical team, her limited workup has so far revealed moderate dehydration and moderate cortical atrophy as visualized on a head CT scan without contrast. Our first question is, given the information provided so far, which diagnoses are most consistent with the clinical presentation? Neurocognitive disorder, depression, delirium, anxiety, or bereavement? Got to choose 2 out of 5. The most likely ones are she has a form of dementia and she certainly could be delirious, right? Again, don't tie yourself up in knots. Go with the obvious thing unless there's some really strong reason not to. Our next question, given the likely diagnoses you chose in the previous question, what would be your next clinical step? Start an antidepressant, restart alprazolam at a low dose, call the Department of Health and Human Services, complete a thorough medical workup. So again, see how this question is kind of linked to the question above, like given her diagnosis, what would you do now? And of course the answer is complete a thorough medical workup. Now, since she has no next of kin, calling the Department of Health and Human Services also makes sense. It's not a bad answer, but if she's delirious, right, we regard that as a medical emergency, or at least a very urgent thing, and that's what we're going to do, number 1. Number 3, given the suspicion of delirium and the information provided in the vignette, what are the most probable contributors to her condition? And now we choose 3. Neurodegenerative disease, depression, dehydration, alprazolam use or withdrawal, or Wernicke's encephalopathy. Which of the 2 would you eliminate? Which of the 3 would you choose? And you would choose neurodegenerative disease, maybe she has Alzheimer's disease, and she's got dehydration, which could tip her into delirium, and also she may have been using or maybe withdrawing from the alprazolam, and they may be causing or at least contributing to her presentation. And our 4th and last question of my little example here, given your likely diagnoses and the patient's presentation, which medical legal steps will you likely take? And choose 2. Assess whether the patient has the capacity to provide informed consent for further non-emergent treatment. B, seek a guardian if she does not have capacity to provide informed consent. C, to maintain your confidentiality, do not share your working diagnosis with the medical team. Or D, advise the patient to assign power of attorney for healthcare to you so you can complete your assessment. Of course, the first 2 seem most sensible, and the last 2 don't seem sensible at all, so that was kind of easy. All right, so exam taking tips. We're drawing to a close now. So there are all of these sections, 8 sections, and there are these neurology questions which are now down to 4 to 6%. Everything is pulled together, so it's not like you got to pass, standalone sections and then you have to pass also vignette sections. It's all pulled together, 450 questions. You just got to make it over the cutoff, which again, I said is probably like 70% questions correct. It may even be, you can even maybe pass with a lower score. But just to be safe, I like to tell people 70% and above, you're probably very, very high chance of passing if you get that number of questions right, that percentage of questions right. Now, I wanted to tell you more about kind of like handling your kind of mental game during the exam. A very long exam, and you have to keep your wits about you, as I already mentioned earlier. So now let me give you another kind of a tip about this. So I like to think about questions on the exam as kind of leading to 3 different types of reactions. So there's 3 categories of questions, not based on content, but based on your reaction. So there's one category of question where you look at them and you just feel 100% sure of what the answer is. Like, oh, this is so easy. I know it. You know, it's bupropion you should avoid in eating disorder. It's like, oh my God, this is so easy. On the other end of the spectrum, you're like, I'd never even heard of this. What is this? Am I even in the psychiatry exam? Did they give me a wrong exam here? You're completely clueless. There's a third category, right, in the middle. It's the biggest category. And those are the questions you feel like, I think I know. I'm not 100% sure. And you have to then answer them while there's some level of uncertainty. And this is probably especially true of those vignette questions. And I'll talk more about that, why that is in a bit. But, you know, you're going to be left with a certain level of uncertainty. So this has the following implication. When you're on an exam, you're kind of thinking like, you know, you might be 10 questions in or even 5 questions in, right at the very beginning of the exam, and you're already might be like panicking, like, oh my God, I spent so much time preparing. I mean, you could like listen to your thoughts. I spent so much time preparing. I thought I was prepared, and like, yeah, damn it, I don't know these questions. How come I don't know them? Right? Can you imagine kind of those kind of thoughts? I mean, right at the beginning, it's so easy to get discombobulated. So I'm telling you this to warn you, forewarn you. I'm trying to inoculate you so that when you have that kind of feeling, that kind of reaction, and start having those kind of thoughts, you're going to say, you know, Dr. Jack said I would be thinking and feeling this way. And he also said, and I'm going to tell you this, you're going to be okay. Everyone has a big chunk. The biggest category of questions are you're going to feel like I'm not certain if I'm getting them right. Therefore, even people who have extremely high scores when they get the results back, they still leave the Pearson Learning Center just devastated, like, oh my God, like that was horrible. And then you're talking to your, you know, significant other, and he or she says, well, how did you do? And you're like, oh my God, this is horrible. Oh my God. And then you're gonna like, I gotta email Dr. Jack. How, you know, these are all these questions. It's okay. You're gonna pass. These questions, you're gonna be uncertain, and you're still gonna get them right. Majority of them you're gonna get right. So again, this goes back to what I said earlier. You have to trust your gut. Don't second guess yourself, all right? And now this is where I said I wanted to talk more about the vignette style questions, these extended vignettes. They're much more based on judgment. They're not like one is brightly right and 4 are brightly wrong. There's a range. And as I kind of even pointed out, you know, you might be, you know, might ask you like, what's the next best step? And you might be like, wow, my God, like 3 out of 5 of these or 4 out of 5 of these are great next, or not, you know, things I want to do. Yes, but you have to pick the one that's most urgent then, or most important, either, you know, to stabilize the patient or to confirm or, you know, lead you down a diagnostic pathway or what have you. So you're just going to have to trust yourself. This goes beyond just kind of like your cognitive knowledge base. This has to do with your kind of confidence in your clinical acumen. So the, you know, sure, you're going to spend a lot of hours, I mean, you probably already have, preparing for this exam, but I'll tell you, you spend a lot more time learning to be a psychiatrist, you know, right? At least 4 years. And so that, all that clinical acumen, all that experience that has now been part of you and your thinking, trust it, make use of it. This is the way I put it. If you're not sure, like, what would I do next, imagine that this was actually in your office or in your emergency room and you had to do the next thing. And you could only do the next thing. What would it be? So kind of think about it that way. What makes most sense here clinically given this presentation? Again, because the next thing is, it needs to be the most urgently, you know, conveyed treatment or maybe whatever assessment kind of approach. All right? So again, you're going to do well. People have very high pass rates with this course. We cover all of this stuff. I look forward to your questions. I look forward to, you know, to your emails even, so I can answer your questions later on, feel free. I want to be here for you, not only again kind of like to share kind of psychiatric information with you about content on the exam, but just to be kind of supportive and kind of like answering these or giving these kind of tips to help you with your head game during that long 9.5-hour exam day. All right? So that's it for my presentation. By the way, here's my email, drjack@americanphysician.com. And Angela, do we have any questions from the audience?
Yes, we do. Alegna is asking, is there a highlight and strikeout option on the exam because it is not available on the Beat the Boards QBank?
No, I don't believe there is. I'll check if they added something this year, but as of last year, there was no strikeout option.
Okay.
Yeah.
And as of now, I think that might be the only question. You guys, if you have any questions, please comment them below the live stream right now. I'll read them, and Jack will answer them live.
Yeah. So, as we wait, again, go where the money is. So the 7 big categories, content categories on the exam, let me go over them again. Going to be substance-related disorders. That's a very big one. That's a very big one. And I want to highlight that one because, again, we have very good pass rates for our doctors who take our course. But for the doctors who don't pass, I notice that the category where they are not scoring well on, in particular across the people who don't pass, are the substance-related disorders. As you know, there are a lot of substances, there are a lot of different disorders. It's not only like the, let's say, alcohol use disorders, but there's alcohol intoxication delirium, alcohol withdrawal delirium. That's just a complicated topic. So it's the substance-related disorders, the psychotic disorders, depressive disorders, bipolar disorders, anxiety disorders, personality disorders, and the neurocognitive disorders. Those are the 7 big ones. If you want a couple more, the next couple that are kind of medium number of questions are the human development questions, and then kind of like forensic ethics and things like that. Those kind of are medium level questions. And then again, when it comes to within a category, diagnostic category, the biggest number of questions are going to be treatment related. Okay.
All right, we have a couple more questions coming in here. So one from Ryan that asks, or that says, the questions that require multiple answers, will they tell you to choose 2 or choose 3, or do they ask you to just choose all that apply?
No, they do not ask choose all that apply. They will tell you exactly, choose 1, choose 2, or choose 3. So you know exactly how many you have to choose.
Awesome. And then Patty is saying, I am trying a 3rd time. I really studied using Beat the Boards and other materials last year. Do you have any other suggestions so she can pass her exam?
Oh, well, you can always look at other QBanks. We have, a ton of questions in our QBank, including the, extended vignette questions, the written vignettes and the video vignettes. And I'm actually going to be going over them and seeing if they need any kind of updating or expansion, things like that. So we do have a lot of questions, and I'm highlighting this fact because we find that doctors who get the Beat the Boards course will tend to much more consistently look at the lectures, and I'm proud of the lectures, but the questions are also very useful, and we find that a lot of doctors don't use the QBank, so please use that. The other thing to keep in mind is I do think using the pocket guide of the DSM-5 is very useful, because so many questions, other than the treatment, the next kind of biggest category across the diagnostic groups is going to be diagnostically focused questions. So you do need to learn the criteria. As I mentioned, the way to study them is not just to try to memorize the criteria, but try to almost build a mental picture of what that patient would look like, and how is that going to be different? How is bipolar 2 different than cyclothymia? I mean, something easy like that, or What is agoraphobia again? Kind of make it so you can recognize it, because that's how you're going to be tested on it. Not like, a list of criteria, but they're going to be incorporated in the vignette, and you have to recognize one disorder as opposed to the other four that are, that are in the response options. So I think knowing the DSM-5 criteria is very useful. And for example, if you're starting child adolescent psychiatry and you're really focused on that, but the whole book is open game. And certainly in my residency, there were many categories of patients that I really never had very much, kind of a clinical contact with. So just kind of look at the book, what's there. And, for the course, we cover all the diagnostic categories, but it's really good also to just spend more time learning the parts of the DSM-5 that you normally don't look at, or patients you don't see.
All right, I'm not seeing any more questions coming through on the comments down here, so we'll give it another couple minutes just to make sure that anyone that does have a question has a chance for you to answer it. Make sure if you do have a question, please comment it down below the video. If you're sending it anywhere else, I won't be able to see it, and it won't be able to get answered right now live. So make sure you're sending them there.
Yeah. So just as we're waiting to see if we get any more questions.
We do. Oh, sorry.
Yeah. Okay. Go ahead.
Sorry. So Thou, sorry if I pronounced your name wrong, is asking. Oops. Whoa. It went out of the place. What do you recommend for us to do a week or days before the exam after we have spent a good amount of time in preparation for the exam?
Well, I think that, in terms of like reviewing the material, if you want to do a last kind of glance over it, use your judgment. Look at the things where, you feel like, I really don't understand something or other. It's almost like, here's a list of points I just want to clarify in my own mind. So, like if you ever remodeled your house and the contractor does everything, and then you walk in and you have like a punch list of like all the things that need to be still kind of fixed. You can kind of have a punch list like, gee, I just realized, how do I treat OCD if the patient fails SSRIs? What's next? Or are there any kind of somatic treatments that work for it? So you're like, oh, let me just kind of check in on that. So just this may not make any difference for whether you pass or fail, but this is kind of a confidence building kind of exercise. And again, the other thing is just make sure you're in good physical shape. This is like you're running a marathon. You got to be well rested. Just eat right, sleep right. And again, if you need to use a hypnotic, by all means, just don't try it out at the last minute. And let me go back to the point I was making. Like so many times I hear from doctors saying like, I'm just a really bad test taker, and I know all this stuff, and I just don't do well. And I think let me share a couple reasons why that might be. Why perhaps you may not be able to convert your deep knowledge into answering questions well. One of them may be just kind of what I said, like. When you're reading diagnostic criteria, you might be trying to memorize all this stuff, but it really isn't the main point just to memorize those criteria. It's a matter of recognizing a particular psychiatric disorder and being able to differentiate it from ones that are like related but different. So kind of think about it, like when you're reading the criteria, it's like, well, how is this different from that? And how would I recognize this? So you're kind of like trying to bring it to life. That's one thing. The second one is, I think, again, part of the head game, like that kind of being overwhelmed by the uncertainty and then freezing up and then just kind of like almost giving up. It happens. So that's why I'm making such a big deal about this. It's like, please just trust yourself. Please trust yourself. You have every right to trust yourself. Again, that doesn't mean you're going to get every question right. You might get a lot wrong, but if you trust yourself, believe me, that is so much better than not trusting yourself. Go with what you really feel is the right answer based on your 4 years, at least 4 years of very hard work on becoming a psychiatrist. Is that it?
Yeah, it looks like there's no more questions
Well,
coming through.
All right. Well, listen, thank you so much for joining me. You got my email. If I can do anything to help between now and the time of your exam, feel free to reach out to me. So signing off, it's Dr. Jack. Thank you so much.